Now that we've gathered all of our equipment, now let's look at actually inserting the IV. So number one, make sure you put on gloves. Then we're going to apply the tourniquet to the arm. We then want to assess the veins and see which insertion site's going to be best for us. Now, once we've found our site, we want to release the tourniquet. Now, we do this because we want to locate our vein. Then we want to release this because the longer that tourniquet's on, the more circulation for your patient can be impaired. So that's why we release it at this point. Then once we found that site, we're going to clean this thoroughly with alcohol for at least 30 seconds. So now that we've gotten our equipment ready, now let's talk about the actual IV insertion. So because I'm going to make contact with my patient, I'm going to first put on gloves.
Very nice.
So when I apply this to my patient's arm, know that once we apply it, it's going to be a little bit tight. So you may want to forewarn and let your patient know about this. So here's the key when we apply it. We're going to go underneath the arm, and everybody does this just a little bit different, but I'm going to pull it close. Do you see where my hands are close to the patient's arm? I'm going to pull it nice and taut, and then I'm going to cross them over. So what it allows me to do is to grab this piece that's still nice and taut, put my finger here in the middle like making an X, and then I'm going to loop this ear underneath the patient, or excuse me, underneath the tourniquet itself. So we're going to have a loose loop here, and you're going to see that tail out. So hopefully that makes sense to you. So if I need to release it, it's going to look like this. So I'm going to show you one more time what that looks like. So I'm going to put this underneath the patient arm, and again, the closer that you put it is a very loose, as you can see, tourniquet. Because what is that doing? Not a lot, right?
Not a lot.
Okay.
Yeah, that's true.
So let's relook at this skill part. So when I'm putting on the tourniquet, if you will hold it nice and taut, close to the patient, cross over your hands. If you will hold on to it with the left hand, and we're trying to make an X. So once I've made that X, I can hold these together, and I'm going to loop this left side underneath, and do not pull it all the way through, and here we've applied our tourniquet. So this should be nice and tight on the arm. So know the longer we keep this on, this can definitely impede circulation, so keep that in mind. So now that this is on our patient's arm, now we get to assess the veins and see which insertion site we want to go. This is a good time to really make a decision on where we want to go before we stick. Now, when we're looking at our patient's arm and we're choosing a site, one thing to remember, you do not want to stick on the inner wrist of a patient. Reason why, there's some very tempting veins here for sure, but this is a high risk area of really causing some sort of nerve damage for your patient. So try to avoid the inner wrist of catheter insertion from distal to proximal. The reason why we want to do this, if we start an IV down here and we have complications, we want the ability to move up. All right, so when we're assessing IV, what we want to look for is there's great veins in the hands, but this can be uncomfortable if a patient's eating. I have a personal favorite. There's some that are here on the side as well that kind of run the thumb side, and you can kind of see me pressing on it. Also, of the very popular, there's some in what we call the AC, or antecubital, on the inside aspect of the arm. So when we're doing this, you want to make sure you palpate. So I'm going to go ahead and release that so we can give his arm a break. So again, just to talk about vein selection, avoid the inner wrist. There's some great ones on the hand. There's also some nice ones on the side of the thumb. Also in the AC or antecubital area is a very nice place to go because it's easy to visualize, and usually you have a large vein here, and there's typically a pretty easily identified site in the AC area. So as the nurse, you need to choose of what's going to be best. All right, see on Peter's arm, you can see lots of coloration of what the vein would look like. That doesn't mean it's going to be a great vein to puncture. So let me say that again. You can see the different colors of where Peter's veins are here. Now the problem with that doesn't mean it's good for IV insertion. So we want to go by feel. So when we go by feel, when the tourniquet's on, when we use our finger and push, or what we call palpate the vein, you should feel a nice little bounce. That's what we want. So that's the vein to go for.
Okay.
All right, one more really important key. If you're in this area and you're going to feel a vein and you feel a pulse, that is an artery. Do not stick that. I'll say that one more time. If you're in this area
very good,
and you feel or see a pulsating, that is not what we want to stick. That is an artery, not a vein.
Yeah.
And this is peripheral IV insertion. So just keep that in mind. All right, so once we've identified that site, considering all those things, release the tourniquet. And now that I know where I want to go, I'm going to take my cleaner and make sure this is clean for insertion.
Yeah.
So depending on your IV start kit, you have options. So this particular kit has what we call ChlorPrep, pretty handy little guy here. So we're going to point this down and we're going to crack this, and you usually can hear it. Hear that nice little crunch, very satisfying. So we're going to make sure this is feeding the pad, and we're going to really scrub this in a motion for at least 30 seconds. So as you notice, I'm using a nice circular motion, and notice I'm not just cleaning the site, I'm cleaning everything out and around of where that possible transparent dressing and where I'm going to be. So we've cleaned the site, we're going to reapply the tourniquet.
Okay.
Then at the insertion site, we're going to use our non-dominant hand to stretch the skin and stabilize the vein. This is going to help keep the vein in place. Then we're going to place that IV catheter on top of the vein at a 10 to 15 degree angle. So we're going to puncture the skin and vein wall and watch the blood flash back in the catheter itself.
Yeah, that's backflow.
Then we're going to use the hand holding the IV catheter, use our dominant index finger to separate the catheter from the needle and advance it into the vein.
Yeah.
Now at this piece, we want to make sure we advance the IV catheter all the way to the
All
hub.
the way through to the hub.
Next, we're going to hold pressure above the insertion site with our other non-dominant hand and hold the hub of the catheter in place so it doesn't wiggle.
Yeah.
Now we can release
Beginners-
our tourniquet,
beginners can always
and with the
name using
same
a
hand
pen
that is holding the catheter, using the dominant index finger to activate the safety mechanism and remove the needle itself. So if you see this picture, notice that we're only advancing the plastic part of the catheter and the needle part itself is removed.
Is removed. Yeah.
Okay, so we just identified our vein and we clean. So now we're going to move on. So I'm going to go back to reapplying the tourniquet. And if you guys remember, we're going to hold this nice and taut. Whoop, a little too taut. Nice and taut. And then cross this over. And then I'm going to hold and support it with my finger here, make that X, and then loop this back through. So this can be nice and quick release when I need it. So notice I've put this a little bit higher up on the arm for my patient. All right, so now I get my catheter ready. So when I have my catheter for needle safety, I want to make sure I go straight out.
Yeah.
So every device is a little bit different, so we need to keep that in mind. And before we puncture the skin, we need to be able to see the bevel up. What that means is when I look down at my catheter, I can see a little bitty hole, and that's what we want, bevel up. All right, so now that I've cleaned, I can advance. So I need to hold my skin taut, and now when I puncture, I'm going to go at a very 10 to 15 degree angle. I don't want to go like this because I can puncture through the vein. All right, so now that I've punctured the vein, so now that I'm in the vein, what I'm looking for is flash. So as soon as I get flash, I want to go ahead and lower my needle and making sure it's flush with the skin and advance the catheter firmly and smoothly all the way to the hub. Now once I've done this, this is where it's going to go fast. So you want to make sure we release our tourniquet. I want to make sure I hold on to my hub so I don't lose my sight and hold down on pressure. I'm going to push my ejection button and I'm going to release the needle. Then at that point, this is where I'm going to go ahead and I'm going to put on my pigtail here.
Okay. Good job.